Getting enough sleep is not just a luxury, but a necessity for your body to run at its highest potential. About 1/3 of Americans are not getting the sufficient sleep they need to fight off chronic diseases and conditions. On tonight's episode of Health Now, we'll dive deep into the field of sleep medicine and the various services that are helping patients at St. Luke's. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at advances in sleep medicine offered at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Dr. Matthew Smith, a neurology and sleep medicine physician. He sees and treats a wide variety of neurological conditions and has a special interest in treating headaches and sleep disorders. Dr. Smith earned his medical degree at the West Virginia School of Osteopathic Medicine in Lewisburg. He completed his residency at Grandview Hospital and Medical Center in Dayton, Ohio, and his fellowship in sleep medicine at the Cleveland Clinic. Welcome to the show, Dr. Smith.
Thank you. I'm honored to be here.
So tell us, what is sleep medicine and why did you go into this field?
Sleep medicine, simply put, is the study of sleep, specifically the physiology behind why we sleep, how we sleep, the different neural processes that are involved, as well as the treatment of sleep disorders. I personally got into sleep medicine honestly because I find it fascinating. Specifically with my neurology background, I find those different intricate pathways, neurotransmitters, everything that makes us sleep is very, very interesting to me. Sleep is very important in a lot of different processes, and especially in neurology that I treat regularly.
What is that connection between sleep and neurology?
So there are a lot of different nuclei within the brainstem and so forth that are involved in making sure that we sleep. Then by extension, sleep itself, through research over the more recent years, has been found to be keenly tied to different processes. Specifically, sleep deprivation and certain sleep disorders such as obstructive sleep apnea have been tied with an increased risk of different neurologic disorders, including chronic headaches, even seizures and strokes.
So the risk is not just being tired the next day.
Yep,
it's much greater
exactly.
than that. Well, thank you for being here. Joining our panel next is Dr. Gautam Narla, a sleep medicine physician with a special interest in chronic obstructive sleep apnea and insomnia. He earned his medical degree at NRI Academy of Medical Sciences in India. He completed his residency at the former Easton Hospital, now known as St. Luke's Hospital Easton Campus, and his fellowship in sleep medicine at St. Luke's Hospital Anderson Campus. Dr. Narla, thank you for being here.
Thanks, happy to be here.
How prevalent are sleep conditions, and what are some of the most common issues that you see in your practice?
Sleep issues are more prevalent than we actually know. So sleep apnea, which has been growing in awareness over the past 20 to 30 years, has become a problem for almost 39 million Americans. And the ASM estimates that almost 80% of people with sleep apnea don't know that they have sleep apnea. Even insomnia is present in 10 to 20% of Americans, and a lot of times they don't seek treatment for it until it really starts affecting their daily life. There's also a lot of lesser known conditions such as restless leg syndrome, narcolepsy, and sleepwalking. These are all concerns for other sleep issues that people deal with here.
And what is one of the most common things you hear when people come to you? Because I would imagine that people just start to think some of this is normal and how they have to live.
Right, so I guess they don't realize it until it starts affecting their life, where they're tired during the day, they're sleepy, they feel like their memory and concentration is not as good. So I feel like until it really starts to take a toll on their work and family life, that's when they generally will come in.
And Dr. Smith mentioned the connection to neurology being of interest to him. What about you? What drew you into sleep medicine?
Having a background in internal medicine, we generally take care of a wide range of issues. And sleep was probably one of the most underappreciated parts of internal medicine that, a lot of internal medicine doctors would not take into account.
But it affects so much of someone's being. Thank you both for sharing why you got into sleep medicine. We're excited to learn more. We'll be right back after a short break, but before we do that, let's check in with Dr. David Cohen out in the field as he discusses state-of-the-art technology used at the St. Luke's Sleep Labs to diagnose and treat patients.
Hi, my name is Dr. David Cohen. I am a sleep medicine specialist at St. Luke's. My initial training was in neurology after medical school. I always found the brain very interesting and complicated. As part of my training, I had a lot of exposure to sleep medicine. That's when I first realized the connection between neurologic disease and sleep medicine. Most Americans do not get enough sleep. Now, this is not just for adults, it's actually across all age groups, unfortunately. This is a problem that affects most people throughout our area and can cause a lot of consequences. So there are a lot of factors that can affect sleep quality. We look at substances. So alcohol is one, caffeine is another substance. Not having a consistent sleep schedule can overall affect sleep quality and lead to sleep problems. We have two main tests that we do in our facility to diagnose sleep disorders. So one is a test called a home sleep test. The other is a test called a polysomnogram. So a home sleep test is a test done where patients will have equipment that we provide to them and they sleep at home in their bed or home setting. The equipment we use includes a oximeter on the finger to measure pulse rate and oxygen levels. There's a little cannula that goes inside the nostrils to measure breathing, and then there's a belt that the patient wears to measure the effort or work of breathing. The goal of a home sleep study is to evaluate for only obstructive sleep apnea. A polysomnogram is a test done at our facility. So we have a bedroom that patients will sleep in overnight. We use many sensors to measure various aspects of sleep that we are not able to measure at home. And the goal of the test is to capture a normal night of sleep. We try to make it as comfortable as possible so that way the patient can obtain a good night of sleep. What I think makes us stand out is the care we provide in complicated sleep disorders. We see all sleep disorders in our practice that ranges from obstructive sleep apnea. Insomnia is a very common problem that we see a lot of. We all know that sleep is extremely important. I think the depth of our department really helps ensure that our patients get the important sleep that they need.
A good night's sleep is priceless. If you are experiencing sleep difficulties, St. Luke's Sleep Disorder Center can help. We provide quality care through comprehensive clinical evaluation for all sleep disorders, including insomnia, restless leg syndrome, narcolepsy, snoring, and obstructive sleep apnea. We can also evaluate you to determine if the Inspire device for obstructive sleep apnea is appropriate for you. Inspire is used to keep the airway open while sleeping without a mask. If your doctor or one of our sleep medicine specialists prescribes a sleep study, St. Luke's Sleep Disorders Centers offer a quiet sleeping environment with spacious home-like bedrooms. During your study, registered sleep technicians provide customized care. They are with you every step of the way, monitoring heart rate, oxygen levels, and muscle activity. Many patients can complete the sleep study from the comfort of their home using our sleep technology. A St. Luke's board-certified sleep specialist reads and interprets the results of the study and coordinates follow-up treatment if needed. The first step to better sleep starts here. To schedule your appointment, call St. Luke's Central Scheduling at 1-866 St. Luke's, option 2.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
Welcome back to St. Luke's Health Now. Tonight we're discussing sleep medicine and the many advances offered at St. Luke's. We want to thank you, our viewers, for tuning in and also submitting questions that'll be answered later in the show. Joining me are Dr. Matthew Smith and Dr. Gotham Narla, who are experts in the sleep medicine field. Let's examine some of the sleep disorders and some of the treatments. Dr. Narla, I'm going to start with you. Can most sleep disorders be diagnosed by patient history alone, or do they need further studies?
Patient history is always helpful, but Further studies also will diagnose certain conditions such as sleep apnea. Generally, sleep apnea is diagnosed with a sleep study, either a home study or an in-lab study. Other conditions such as insomnia are more diagnosable through patient history. So a lot of times just getting a better idea of how they're sleeping, how many hours they're sleeping, if there's a lot of sleep interruptions. So that is mainly based on information from the patient. And once we get an idea of that, we can come up with a more accurate diagnosis.
Often people don't go to the doctor because they're worried about the treatment. Are there conservative options that are involved in sleep medicine?
For insomnia, a lot of times people think medications are the best way to treat insomnia, but more so we like to try therapy first. So there's something called cognitive behavioral therapy for insomnia. So that's with a sleep psychologist. And their therapy is basically based on things such as improving your sleep hygiene, such as decreasing alcohol intake or caffeine intake, avoiding watching TV before bed. So those kind of things can be more helpful than just starting someone on medications.
That's great to know. Dr. Smith, let's talk about snoring. So many people snore. If you snore, do you definitely have sleep apnea? Are they always related?
So not necessarily. Snoring at its core is turbulent airflow causing vibration of different regions along the airway, more commonly anywhere from the nose to the back of the throat. And so that noise could come from kind of sinus congestion or anything along those lines. Now, of course, by the time somebody reaches us in the sleep clinic, very commonly they have other symptoms along with it. If somebody comes in with snoring, typically we suspect sleep apnea if they have other conditions or other symptoms along with it. Now, these could be as simple as being very sleepy during the day, or as much as having, they have a history of high blood pressure, a history of stroke, cardiac arrhythmias, things like that, that make us concerned that they may have sleep apnea underlying. So it is possible.
If you're diagnosed with sleep apnea, or even if you suspect you have it, what are the risks involved and why should it be something you don't ignore?
One part of it is as simple as being symptomatic. Sleep apnea of any severity can lead to significant symptoms. It can cause, most substantial among these is the excessive daytime sleepiness, which can affect somebody's well-being, their quality of life, even to the effect of driving and impacting their ability to drive and operate a motor vehicle safely. But in addition, based on the mechanism of sleep apnea in general, the fact that it's causing recurrent stress response with recurrent drops in oxygenation that are waking you up throughout the night, that constant stress throughout the night and that constant sleep disruption are what are tied to an increased risk for other pathologies, things like poorly controlled high blood pressure, things like stroke, heart attack, cardiac arrhythmias, abnormal heart rhythms, and things like that. So reducing the risk of these by treating sleep apnea can be very effective.
So don't ignore the snoring. Dr. Narla, you mentioned restless leg syndrome. What is that and what are the treatments available?
So restless leg syndrome is an urge to move your legs when you get into bed at night. It's accompanied by an uncomfortable sensation in your legs. So not so much painful, it's more just uncomfortable and you want to move them around. Generally if you get up and walk around, it goes away. So restless legs can be hard to figure out from the patient standpoint initially, but it can be very bothersome, preventing people from falling asleep. Sometimes it can wake them up in the middle of the night because they'll have that urge to move their legs. Iron therapy is the first thing that we would do. We'll check someone's iron levels, and if they're low, then we would treat with oral iron, in some cases even with intravenous iron. If their iron levels are normal, we can try other medications that can effectively treat.
But very treatable, so something, again, to speak up about. That's important. All right, Dr. Smith, what about insomnia? People wake up at night and maybe they don't understand the difference between just maybe a restless night versus insomnia. So how do you define insomnia and when do you know it's beyond mild?
Insomnia is the most common sleep disorder. Now that is usually because in that data they include both acute and chronic insomnia, acute being the more common of the two. So insomnia, by definition, is either several nighttime awakenings throughout the night or difficulty falling asleep taking more than a half an hour on average to fall asleep. Typically, once they reach us in the sleep clinic, the majority of people have what is termed a chronic insomnia, which is that difficulty falling asleep for at least a half an hour, 3 nights in a week that's lasted for at least 3 months.
Dr. Narla mentioned that insomnia and this idea that what you do before bed matters, that routine. How often, and is that the first thing you ask people, how often is their routine impacting their sleep?
Insomnia is very commonly tied to somebody's sleep behaviors before bed, what Dr. Narla termed sleep hygiene. And essentially what it boils down to is how our brains work, how our brains learn. We learn just about any task that ultimately becomes automatic to us by repetition. And so particularly in developing a chronic insomnia, what's been found to be the key issue is they develop an acute insomnia, and then as a result develop poor sleep hygiene. They end up laying awake in bed for extended periods of time. And this then leads to their brain essentially learning that, oh, bedroom is a place to stay awake and do things other than sleep. And that's where what Dr. Narla hinted at, cognitive behavioral therapy for insomnia, that's what it seeks to correct by essentially retraining your brain.
Really interesting, and we've all heard about putting our screens down 30 minutes before, not watching television, things like that. Dr. Narla, tell us about obstructive sleep apnea. What is it, and what are some treatments available?
So obstructive sleep apnea is something we commonly deal with in the clinic. It's basically an obstruction of your airway. What happens when people are sleeping and they have sleep apnea is their tongue falls back, the base of the tongue falls back, and that airway kind of collapses. The muscles in the airway also kind of relax, so everything just kind of blocks off your breathing. And when that happens, your oxygen levels go down. A lot of times your brain will kind of wake you up wondering why your oxygen is low. So people don't go into the deeper stages of sleep. That can present as a lot of daytime sleepiness, being tired, irritable, having low memory and concentration. So the best way to treat that is by making sure that airway is open all night. So some of the modalities for treatment is one that most people are familiar with, which is CPAP. So that what CPAP will do is push pressured air down the airway to kind of open up that airway when you're sleeping so that it doesn't collapse and your oxygen doesn't go down. Some people have a little difficulty with CPAP, so we try an oral appliance, which is done by a sleep dentist. Essentially, they take a mold of your bite and kind of push your jaw forward a little bit so that that airway opens up. There's been some newer advancements, which is the hypoglossal nerve stimulator, also known as Inspire, which a lot of people have seen commercials for. So that also works in a similar way by opening up the airway, but it works by stimulating the tongue to move forward so that people are able to breathe.
And that's an actually implantable device.
Correct. So it's implanted. They make an incision right about here where they put in the stimulator, and they make an incision here where they put an electrode on the nerve that supplies the tongue.
And about how common is that as the treatment option for people who are suffering from sleep apnea?
Generally, it's after, if you can't handle CPAP or if maybe the oral appliance isn't for you, then we will go with the Inspire device.
Okay, so a graduated type approach. Dr. Smith, what about light exposure therapy or neurofeedback? Can you explain what those are and how do they work with sleep medicine and sleep problems?
I'll start with neurofeedback because that ties in with something that we've discussed already, and that is that cognitive behavioral therapy for insomnia. So neurofeedback acts as part of that therapeutic approach, that behavioral therapy to correct insomnia, essentially retraining your brain to associate your bed and bedroom with sleep and counteract any of those anxious thoughts, racing thoughts, and then allow your brain to recognize that even if you have those anxious thoughts, even if you have those difficulties, that once you get into bed, it recognizes, oh, this is where I sleep, I'll do those other things somewhere else in the house, and ultimately help you fall asleep again without any kind of pharmacologic requirement. Light exposure therapy is something that we will fairly commonly use for somebody who has what we term a circadian rhythm disorder, or essentially a difficulty with their internal clock. Now, it's important to note that simply having a slightly off internal clock isn't necessarily a bad thing. Think about my internal clock versus somebody in California, right? We're going to be a few hours off. Neither of those is necessarily wrong unless it interferes with life, unless it interferes with their job, their livelihood, and so forth. At that point, we may consider shifting their internal clock to a more appropriate time for where they live or their situation. And light exposure therapy is oftentimes used in that regard to help convince their brain, oh, it's daylight, we need to be awake earlier.
We're learning so much about so many possible treatments, and I'm not sure that everyone's aware of that. So Dr. Narla, What would you say to patients out there who might be struggling with insomnia or snoring or anything and restless leg syndrome, and they're not sure what to do?
Generally, you should come in and see a physician. If it's affecting your life, then it's something you should see someone for. And there's a lot of different treatments and conservative measures we can do to help make you feel better during the day.
Thank you both for such great information. It's amazing how many options are available if you're suffering with your sleep. Speaking of, we have some questions sent in from our audience. Let's get to those right after the short break. Stay tuned.
Complex conditions of the nervous system require extraordinary care. At St. Luke's, it begins with a compassionate team of neurosurgeons with incredible skill sets and advanced level practitioners experienced in caring for patients with conditions of the brain and spine. A neurosurgery visit does not always mean surgery is the only option. And when surgery is the best option, St. Luke's offers minimally invasive neurosurgical approaches. St. Luke's, the neurosurgical care you trust now more than ever.
Membership in the Children's Hospital Association can benefit everyone who's caring for children.
We have access to resources that we might not otherwise have.
Each floor is uniquely themed and interactive for kids to be comfortable in a setting that can sometimes be anxiety-provoking when you're outside of your home.
First and foremost, children are our future. So if we want a healthier tomorrow, if we want a healthier generation going forward, it starts right now.
You're determined to stay active and enjoy life. Be at your best every day with St. Luke's Orthopedic Care. Start here and we'll get you back to doing what you love. With locations throughout the region, including our new St. Luke's Orthopedic Hospital West End campus, the best place for orthopedic care is always close to home. St. Luke's Orthopedic Care. Start here, go farther.
Hi, my name is Kevin. I suffer from a sleep disorder. I suffered many years. I didn't know what was going on early in my life. I always felt like I was tired all the time, like I never had a good night's sleep. I've had MRIs, CAT scans, nobody could figure out what was going on, and it just got worse over a period of time. I actually fell asleep at the wheel, and I went in the other lane, and the truck blew its horn. I got over on the right, I got off the road, and I thought there's something wrong. I went to my wife and I said, you need to do something. And that's where Dr. Cohen and St. Luke's came in, and I did a sleep study. It was different. I never went through anything like that, but you had to stay overnight. And they hooked you up to a machine and they watched you. They found out the cause, what was wrong, CPAP machine they recommended. And ever since then, 1,000 times better. I recommend it for anybody. It was an amazing experience. Dr. Cohen is a stand-up guy. He's straightforward, told me what was going on. He said it might take a couple days to get used to it, and it did. It took a couple of days, but once I got used to it, I can't do without it. St. Luke's Sleep Lab was fantastic. I mean, I recommend anybody who is going through this, do it, because it's gonna make you feel better. The CPAP machine changed the way I sleep. When you use it all night and you wake up the next day, you feel like you're alive. It's a whole new way of living without being tired all the time. Because I know what it's like to suffer, but finding out what the problem is and doing it, you're gonna feel 1,000 times better than you ever have before. And I recommend it to anybody. I love St. Luke's.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. We've had a great conversation about sleep medicine at St. Luke's University Health Network. And thank you to both of our panelists for being here. All right, now it's time to answer some questions from our audience. You ready?
Yep.
All right, Dr. Narla, I'll start with you. What is the difference between having poor sleep quality and a chronic sleep disorder?
The difference between having poor sleep quality and having a sleep disorder is that a sleep disorder generally has to affect your life in some way. So if you are having difficulty functioning at work, you're falling asleep at work, you can't concentrate properly, or you're very irritable, those are all things that are affecting your daily life. So when that happens, we call that a sleep disorder. So for example, chronic insomnia is usually diagnosed when, like Dr. Smith was saying, when you it occurs 3 days a week for 3 months, and you have some way where it's affecting your life, then it's considered a sleep disorder.
All I know is that my sleep is very important to me, so I would imagine if you're not sleeping well, you might have a sleep disorder. All right, Dr. Smith, this question is for you. My husband snores every night, and I usually have to nudge him to roll over on his side. What should I be worried about, and could it be something serious?
In that regard, similar to what we talked about before, especially if it's severe enough that you feel the need to nudge your husband in order to have him roll over because you're afraid that he's not sleeping well, that is a situation where I would be worried about something like obstructive sleep apnea or another form of sleep disordered breathing. And at that point, I would definitely recommend that he come in and get checked out because of the potential risks involved.
Excellent. All right, Dr. Narla. This viewer asks, I started working shifts, night shifts, 6 months ago, and I have a difficult time falling asleep when I get home. I'm not feeling my best during work hours. Do you have any advice?
A lot of people work night shift or second shift or even rotating shifts. So that can be very difficult on your sleep and also functioning during work. So things that I generally recommend are, let's say you're working night shift and you're driving home from work. Try sunglasses. So sometimes just having sunglasses and avoiding that bright light in the morning can be helpful in allowing your brain to avoid that light, and then when you go home, sleep in a dark, quiet room. Invest in blackout curtains so that that light isn't coming in during the day, so you can sleep better, kind of thinking it's night in a way. Other things are, generally you want to have at least some hours that you sleep regardless of whether you're working or not working. So if you're working night shift and you're able to sleep from 9 a.m. to noon, when you're off, also sleep from 9 a.m. to noon. So that's called anchor sleep. So when you at least have a few hours where it's very consistent, that kind of helps you be more refreshed when you wake up.
That's really interesting. Okay, I wouldn't have considered that. Dr. Smith, this one's for you. I've been wearing a CPAP mask to help with my sleep apnea for the past year. Will I need to continue to wear it, or can I consider the implantable device so I can lose the mask? I bet this is a pretty common question.
This is something that I get fairly often. It's interesting. We have all these wonderful different modalities to treat sleep apnea that Dr. Narla explained, and the hypoglossal nerve stimulation, or Inspire, is definitely one of them. It's not necessarily an easy question to answer because it depends on each person. You have to understand the efficacy of these devices varies, and particularly with hypoglossal nerve stimulation or Inspire compared with CPAP, efficacy tends to be fairly similar. Where the catch comes in is that Inspire is a surgery. We have to remember that it is a procedure with its own risks. So in the right patient, somebody who is not tolerating CPAP well, despite a good amount of attempts at using it, despite trying different masks and so forth, then it could be a very good option. I will say that I tend to be hesitant to recommend it in people who are well controlled and tolerating CPAP very well, just because I can't guarantee that this will work as well, and then they've gone through a procedure unnecessarily. But it can be a very good option. I don't want to downplay that.
Certainly worth inquiring with your physician about. Well, thank you both for being here. I personally learned a lot about sleep medicine and the importance of good sleep. For more information on sleep medicine and the services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-St. Luke's. Thank you for tuning in to this special episode. We hope tonight's program leaves you feeling informed, inspired, and most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.